This video will demonstrate how to properly complete clinical experience shifts. This video is intended for paramedic and advanced EMT students. From your dashboard, click on the clinical shift that you want to document on. You will see the clock in button. You may only clock in up to 15 minutes early from the shift start time. It's imperative that you ensure you have clocked in for each shift. Next, click Create Shift Eval at the bottom. This will present you with a screen to pick who your preceptor will be for the shift. Please search for your preceptor from the list. If your preceptor isn't available in the list, choose either ED Medic Preceptor or ED Nurse Preceptor, depending on who you are with that shift. If your preceptor isn't listed, make sure to notify the clinical coordinator, so that they can create an entry for the preceptor in EMCE for future shifts. Next, you will see the shift eval. You should be working on this throughout the shift, entering skills after you do them, and entering patients after you assess them. The area named Isolated Skills is used for quick skills. A quick skill is a skill that you perform that is not attached to a specific patient for that shift. For example, if your preceptor asks you to start an IV on the patient in room 2, or you only give a medication to a patient, you would note those here. Going on, note the area named Patients. This is where you will enter your patient interactions for the shift. It's best to enter an interaction for all patients that you encounter if possible, though as noted previously, the Isolated Skills section is used for those patients that you do not have time to fully evaluate. Click Add Patient Eval. Select the age group for the patient. Select whether this patient was an ALS or BLS patient. Select the pathologies that the patient is being treated for. Select any skills specific to this patient. Once you have finished selecting the skills for the patient, move on to the narrative section. Here you will write the narrative for your patient interaction. Please be specific as to what you did for the patient, along with your assessment, findings, etc. You can use any method that you are comfortable with, such as SOAP, chart, or chronological. After you're finished with the narrative, go back to the main shift eval screen. If this occurrence was a distressing encounter, you may toggle the selector. This will notify the clinical coordinator that you have checked it, and they will contact you about the interaction. Ensure that you click Save for later. Ensure that you enter all of your patients correctly, so that you receive credit for them. At the end of your shift, you will need to complete the preceptor evaluation, read through the evaluation and choose the most appropriate score for each area. You can autofill the scores, then change only what needs to be. Next, you will need to do the site evaluation. As before, read through the evaluation and choose the most appropriate score for each area. It's imperative that you upload your completed shift worksheet and a completed hours verification form, also a quick skills worksheet if applicable, to the shift. These are used for internal and state audits. They must be uploaded prior to your preceptor approving your shift. Once you have completed all of your interactions, documentation, evaluations, and uploads for the shift, then click the yellow Evaluator Review button. Here your preceptor will need to complete the student effect evaluation using the criteria shown. Next, your preceptor will need to evaluate each of your patients, in the assessment, treatment, and management areas per the scoring criteria shown. When the preceptor is finished reviewing the shift evaluation, they will hit the yellow Verify button, and it will prompt them to sign. If your preceptor was not listed in EMCE, and you had to choose ED Medic Preceptor or ED Nurse Preceptor, please enter the preceptor's name into the comments area for the shift. Scroll back up to find the Clock Out button and press it. You have now completed a clinical experience shift.